Good morning, everyone. My name is Dr. Ram Kare. I'm a GI and laparoscopic surgeon at Fortis Hiranandani Hospital, Vashi. Now, today we are going to talk about a very common surgical problem which is called as hernia. So, hernia is a word we all must have heard somewhere in our lives. But do we actually know what is actually the hernia is? So, let me tell you what is actually the hernia is. So, our abdomen is a sac is covered from all the sides by this abdominal muscles. So this abdominal muscles they provide a protection to our internal organs. Sometimes what happens, like if this is a right side abdominal muscle and this is left side abdominal muscle, they all converge in the midline of our abdomen. Sometimes what happens, this muscle they start to split apart, and there happens a defect like this in an abdominal muscle. Through this defect, abdominal contents like intestine, abdominal fat, or any other organ starts to come out of this defect. This is basically is called as hernia. Now, this hernia is a patient will usually notice a swelling over the abdomen, either in the umbilical region or para-umbilical region, or even in the inguinal region, or even at the post old surgical scar. So this swelling usually pops out when patient is standing or doing any strenuous exercise, and sometimes it goes inside when the patient lies down flat. So this is the main sign of hernia. Sometimes it is associated with the pain. Whenever there is hernia, you will have to consult a surgeon and get treated for it. Now, what are the treatment options? Whenever you consult a surgeon will examine first clinically, then he will get an investigation, radiological investigation done. Either it can be ultrasonography or a CT scan, which will delineate the size of the defect and how to proceed with the repair of it. Now, this hernia is a surgical disease. There is no medical management of hernia all over the world. So whenever there is hernia, patient will have to go ahead with the surgery. Surgery can be done in both ways, either open technique or laparoscopic technique, which is a minimal invasive technique. In earlier era, these hernias were usually operated by an open technique, like surgeon had to do a incision over the abdomen or a hernial sac, then dissect everything down. Whatever is popping out of the abdominal cavity, surgeon used to put it back inside the abdominal cavity, and then surgeon used to lay a mesh over it so the defect gets patched and the abdominal contents will not come back again. So nowadays, the same thing is done laparoscopically, which gives our patient less pain, faster recovery from the surgery, and early discharge. Thank you.